Hi everyone, welcome to our outdoor edition of TNT. Plenty of news from around Thailand. A big congratulations to the people who were organising last night's marine safety event in Phuket, particularly Sean Stenning and the team at 5 Star Marine, but there were a lot of other people involved. A lot of homework has gone into putting this event together over the past 2 or 3 weeks. Got a few soy dogs come to keep me company as well. But the outcome, I thought, was very good. 300 people turned up. Industry players, stakeholders, a lot of officials. And it was very apparent that Sean had done his homework to make sure that not only do they come up with all the right words, but there are plans to make them stick into the future. So more about that a bit later in the program, but we'll go to some other news from around Thailand. Heading to Bangkok first, and this is from ThaiPBSWorld.com. 50,000 prepared to work from home if PM 2.5 in Bangkok reaches the red level. I would have thought once it's reached that level and it's time to send them home that the damage had already been done. It says that the BMA has reached an agreement with civic groups for as many as 50,000 of their members to work from home if air pollution in Bangkok reaches and remains in the red level for 3 consecutive days. Which particular districts in Bangkok? Does it have to be at the red level all day? I think we need a bit more clarification. The Governor held a meeting this morning, that would have been yesterday, with senior administrators to discuss the PM 2.5 dust problem in the capital, which has been getting steadily worse, mainly due to poor air circulation and burning of biomass in the countryside and in neighbouring countries. He disclosed that only 525 hotspots were detected between January the 1st and the 9th last year, compared to over 1,000 during the same period this year. And he says that's 107% increase. He said all municipal schools will have at least one dust-free room to accommodate students when air quality is bad, and additional rooms will be built for kindergartens. Pretty much public schools, they don't really have air conditioning, or they don't really have full windows in most cases. They just have open air circulation in the classroom. So if there's air pollution outside, it'll be much the same inside those classrooms as well. And currently the BMA is operating 8 air pollution-related clinics at its hospitals. There's a list of them there, where people who suffer health problems caused by PM 2.5 can seek healthcare and counselling. They can also seek advice via the telemedicine application or by calling 1646 hotline. And a bit more reporting on that from calsodenglish.com. Says the Bangkok governor said on Monday if the PM 2.5 microdust particles reached red or unhealthy levels for 3 consecutive days, he'll urge people to work from home. He said City Hall had banned the burning of agricultural waste, but some air pollution was coming from neighbouring countries. I think the problem is that there's not that many plantations or farms in the Bangkok province. And Chad Chart said the BMA schools have set up microdust-free rooms. 8 air pollution clinics are also available, and those needing healthcare, once again, that hotline 1646. Let's check the IQ air today. This is Bangkok and the surrounding provinces. You can see Pattaya down there right up in the red as well this morning. Not looking particularly good in the central Thailand area. A wider screenshot there showing all of Thailand. Much better up in the north and really good up in the northeast. And down in the south, not particularly good today either. Now, that is partly caused by this situation, and we've got the airflow. You can see the white arrow showing where the air is coming from. Cambodia there, sitting to the east of Bangkok, that's got by far the highest concentration of these plantation fires, and it's affecting everything in that white circle, which is pretty much Bangkok, and then down through Hua Hin, Cha Am, and even Phuket, Nakhon Si Thammarat, Suratani, and the islands there in the Gulf of Thailand. So that's the situation, and of course air pollution is going to be a hot news topic this year. We predicted that it's going to be appearing in the media a lot more than in the past, with a lot more pressure being put on the government to start to do something concrete. Of course, there's plenty of air pollution in the sky around Bangkok, but you can at least control some of the air pollution going directly into your lungs. We go to bangkokpost.com. Excise considers tax rejig for cigarettes. And the Excise Department is considering whether a single tax rate or weight-based levy should be applied for cigarettes. According to the Director General, at present a two-tier system is applied for excise duties levied on cigarettes, which comprises a 25% tax on cigarette packs with a retail price of up to 72 baht, to ease the burden on low-income earners, and 42% for packs priced higher than 42 baht. And packs are also subject to an additional tax of 1.25 baht per cigarette, regardless of the retail price. This means that one pack is subject to a tax of 25 baht, and there are 20 cigarettes in a pack. And he said the two-tier structure prompted cigarette manufacturers to avoid paying high tax rates by selling cigarettes for 72 baht or less per pack, triggering the 25% tax rate. And then he said if a single tax rate is chosen, it must strike a balance between farmers' income, public health, government revenue and efforts to prevent smuggling of foreign cigarette brands which sell at low retail prices. A lot of cigarette smuggling, especially down the south of Thailand. Let's have a bit of a look at what the smoking situation is in Thailand. And this is from tobaccoatlas.org. How many people die from smoking in Thailand each year? It says nearly 71,000. And what's the economic cost of smoking and tobacco use in Thailand each year? And tobaccoatlas.org estimates it at about 192 billion baht. And they also claim that tobacco use continues to be an epidemic in Thailand. And adult smoking prevalence in Thailand, men nearly 40%, women only 3.5%, the average being 21%. That's a massive difference. Do you agree with that? The number of adult smokers in Thailand, men nearly 11.5 million, women 1.13 million. Youth smoking prevalence in Thailand, men 11.3%, women 3.3%. This is kids 10 to 14 years old. And then the use of other tobacco products in Thailand for both men and women about 2%. So it's a bit of a snapshot there of smoking habits in Thailand. Tell us what you think about that. Do you think that putting up the prices or adding taxes to cigarettes might prevent people from starting to smoke? Particularly, of course, we're trying to stop young people trying to smoke. Be interested in your comments. Right, time now to have a look at some of the specifics from last night's event, Marine Safety Event at the White Room in Boat Lagoon. Thanks to all those people who were part of the staging and organising of the event. And as I said, well attended. I think there were some 300 people there. It could have been more. I'm not very good with estimating crowds. But let's go to the nub of why it was an important event. And an MOU was signed by all the stakeholders and all the officials who attended the event last night. And this is what is contained in the MOU. There will be drug testing. All employees of a marine industry company should complete a drug test prior to their first day at work. The employee must present a negative test before starting their work at a company. B, every undersigned company will conduct random drug tests every 15 days. That includes all boat crew, captains, engineers, deckhands and guides. Life jackets. All boats must carry adequate life jackets of an approved standard. Sounds amazing that needs to be said again, but there are some boats who get away with fewer life jackets than the number of people that they're carrying. So they're going to impose that. Training. All boat crews and engineer crew must attend a first aid training course once a year. Then B, captains, engineers and boat crews must pass training and receive a certificate of competency related to their tasks on board the vessel, taking passengers to sea. And the training will focus on safety and navigation, including the use and handling of boats and other related elements. And the training will be designed and provided by the Phuket Provincial Skill Development Office. And rescue. For future planning in the areas where incidents occur frequently, there'll be an arrangement for jet ski boats for quick transport of victims. Well, this is actually quite a good idea, probably one of the only good ideas or good things you can do with a jet ski. But you have these quick response teams on standby on shore, and they've got some good first aid kits, knowledge, skills, and they can get out to some of these spots where incidents are happening really quickly and perhaps even save lives. So a few shots from last night's event, and let me say the main organiser and the host for the night was Sean Stenning from 5 Marine. Sean was on fire last night. He was very well prepared and he hit all the right notes, not only with the officials that were there, but the people in the marine industry, some of the smaller companies who are a bit hesitant to have some of these things imposed on them. It was also made quite clear during the event and during the signing of this memorandum of understanding that there's going to be a lot of follow-up, and it's not just a quick one-night opportunity to network and throw some ideas around, but it's going to be followed up with some more ideas and some training. And he mentioned the first training, which is going to be sponsored by the Phuket government, will be this month. So they're getting stuck right into it. So congratulations to Sean, everybody at 5 Marine, all the people who were organising it. It was actually a meaningful night, and I walked away from the event perhaps a little bit suspicious before I went there, thinking that, yeah, this is going to stick. There are going to be some good outcomes from this. And as Sean Stenning said during the evening, if they can save just one child from dying through all this hard work, then it's indeed all been well worth it. Speaking of safety, the TAT's back at it again, so let's see what the TAT's up to. This is reported in nationthailand.com. TAT's new campaign to reassure foreigners that Thailand is safe. As part of the efforts to encourage more foreign tourists to visit Thailand, TAT officially launched its new Thais Always Care project on Friday as part of the broader Amazing Thailand campaign. I've got a funny feeling the more they mention safety every time people sort of type in the word travelling to Thailand, the more people will go, oh, Thailand, safety, yeah, I sort of remember that. The TAT aims to create awareness among no fewer than 100 million people around the world, and I hope this project will play a part in raising the level of safety and increasing confidence in safety management, thus encouraging tourists to continue to visit Thailand. This is from the TAT governor. The TAT's deputy governor elaborated on the meaning behind the word care, emphasising its 4 key components: compassion, assistance, relief and elevate. Well, that's sort of cute, but what is it actually doing to increase the safety of tourists in Thailand? Going on with the story, according to the Police General from the Tourist Police Headquarters, enhancing the safety of tourists in Thailand involves a 3-pronged approach, namely ensuring the safety of tourist areas through the Strong Tourism Community Project, establishing operational centres in collaboration with local police to enhance safety measures, and coordinating with foreign agencies and embassies to assist tourists. But what about drug testing all taxi drivers in Thailand? What about drug testing all tour guides in Thailand? I mean, let's do some real concrete things. All I've really read in there is just a whole list of words from the TAT. And at the end of the day, they're not really empowered to do anything about safety in Thailand beyond just making people feel good. Now we go to Thai PBS World now, and this story, allegations made over cover-up about long COVID. And I'll read this statement out verbatim. There is an organised effort to cover up information and facts about the number of people who have died or are suffering from long COVID by means of underreporting their numbers, and an effort to prevent public access to such information on social media, leaving many people unaware that they're being affected by long COVID from vaccination and depriving them of proper treatment. And the accusation appears in a joint statement issued by the head of the Thai Red Cross Emerging Infectious Diseases Health Science Centre at the Faculty of Medicine at Chulalongkorn University and the Dean of the Faculty of Oriental Medicine at Rangsit University. So they've got the qualifications to make these sort of comments. Let's go further. Now, the two claim that reports of long COVID among people infected by COVID-19 virus or following multiple vaccinations who have died or who are suffering from a wide range of symptoms are real. They say that some hidden diseases which were previously suppressed by the immune system have surfaced among long COVID patients because their immune system has been compromised. According to medical reports, people with long COVID can suffer a wide range of symptoms which can last weeks, months or even years after infection. Sometimes the symptoms can even go into remission and return. Let's go through what some of those symptoms for long COVID are. General symptoms include fatigue or fever, respiratory and heart symptoms including breathing difficulties, a cough, chest pain or heart palpitations. Neurological symptoms include difficulty concentrating or brain fog, headaches, sleeping problems, dizziness when standing up, pins and needles in the limbs, change in smell or taste, depression and anxiety. Digestive symptoms include diarrhea and stomach pain. Other symptoms include joint or muscle pain, rashes or changes in menstrual cycles. So, of course, when you read that, you think, oh, gee, I've had a number of those things. I must have long COVID. I mean, if you do think you've got long COVID or some complications from vaccinations, you need to go to your doctor, not to the internet. The statement also cites a study published in the National Scientific Report on January 15, which states that after the third vaccination against COVID-19, the T cells in some people weakened, which suggests that excessive vaccinations may compromise the immune system. And the statement urges doctors, traditional medicine practitioners and pharmacists to pool their resources and experiences in providing necessary information and treatment to long COVID sufferers. Finally, they said the authorities concerned must tell the truth about long COVID so people can make informed decisions about whether to receive their next dose of vaccine. A lot of polarised information on the internet. I'm not going to get involved in that. Suffice to say, I've been doing a lot of reading about it, and I don't have the experience or the skills or the education to make a final decision. Again, if you think that you might have long COVID or complications from vaccinations, the best person to go and see is your doctor. And with that, we thank you very much for watching today's program as we whip around Thailand, checking most of the main news stories. If you enjoyed it, please subscribe to the channel, and we might see you tomorrow.